And welcome back. I'm Mabel, Jong. You're watching live coverage from the World Healthcare Congress in Washington, D.C. As we continue our conversations about different healthcare models throughout the country, we're going to take a look at something that's really making waves in Phoenix. Steve Narang is here. He's the CEO of Banner University Medical Center in Phoenix. Thank you so much for being here, Dr. Narang.
Well, thank you for inviting me. It's a pleasure.
Yes, and your experience in medical practice is all across the country. You've taken your expertise to Phoenix, and you've started a partnership with the University Medical Center in Phoenix, the first academic medical center. Is that right?
That's right. Yes.
Yeah.
You know, I joined Banner Health in 2011, first as a chief medical officer, and then in 2013 had the honor and privilege to lead their flagship hospital. At that point, it was called Banner Good Samaritan. 2015, we changed our name because of our merger and alignment with the University of Arizona College of Medicine Phoenix, and that's our name now, Banner University Medical Center Phoenix. So we are so excited to partner with the university to kind of redefine what an academic medical center is in the 22nd century, and we're doing it in the 5th largest city of the country.
Yeah.
So it's an exciting opportunity for us.
Yeah, is that market ready for it?
I think so. You know, when you think about Phoenix, Arizona, it's a rapidly growing environment. It's the fastest growing city, as we just mentioned, and there's no real dominant academic medical presence. We have large, wonderful health systems. I mean, Banner Health has been in existence now for 20 years. It has 29 hospitals. It started off as a hospital company, focusing, like many health systems, is taking care of acute inpatient care. The last 10 years, we've gone through a lot of changes, and we are focused on integrated health delivery, focusing on the consumer across the continuum. So now we have urgent cares, post-acute cares, and about 2015, the board said, you know, we need to explore the idea of partnering with the University of Arizona. They have 2 medical schools, one in Phoenix, one in Tucson. The medical schools were looking for a clinical partner. And Banner Health said, you know, in our alignment with the University of Arizona, perhaps we could add value to our consumer, especially as we become more potent in offering continual, high-end continuum care for all populations. And so the idea of partnering with a medical school where you have a chance to influence medical students from the beginning to work in one organized model across the continuum, so they graduate from medical school, hopefully train at a Banner hospital, and then stay in Arizona to support and serve the community of Arizona. That's the vision. And the vision is to do it in a value-based way. How do we educate and train our workforce, our physicians, and in a multidisciplinary healthcare environment to deliver value-based care, not volume-based care. I think that's the value proposition of this wonderful marriage.
Have you been able to reap the fruits of the vision yet?
Very early. It's it's a 30-year partnership, and I would say that we're still very early in our strategy alignment and structure alignment, but we have been able to realize very quick wins in this area. Number one is, for the first time in Arizona now, the 2 medical schools have a clinical partner that is a robust clinical partner, one of the largest health systems in the country, and together we are now addressing solutions that are very complicated in Arizona as one entity. So the clinical system and the system that's focused on education and research are in the same room, saying, how do we address the workforce shortage for physicians? How do we make sure our new physicians are training in a value-based model? And then how do we make sure there's a sustainable economic model to support both medical schools and the health system? So to answer your question, it's very early, but we are making incredible strides every day. And as you know, it's always behind the scenes. It's the focus on people and culture that deliver the outcomes, and that's what our focus is.
Well, each entity in and of itself is pretty old, but together it's a startup. Yeah. So with a startup comes its own unique challenges. Yeah. How are you addressing those?
Yeah. You know, thank you for saying that. I describe the startup as this: the healthcare system, Banner, is focused on healthcare delivery and how do you improve healthcare delivery. And the medical school is really focused on not just training, but how do you advance the science of medicine. And the marriage, Banner University Medicine, is really how together do we advance the science of healthcare delivery. Not just what is necessarily the newest thing out there, but what is the best way to treat our consumers. And so the challenges right now is just taking 2 different structures, 2 different mental models, literally 2 different worlds, and how do you create the Venn diagram where we're all in the middle of that sweet spot, focusing on the right way to not only train our future physicians, not only invest in education and research and innovation, but how do you do all that and do the most important thing, which is improve care? for our communities we serve. I mean, that's really what this is all about.
Yeah.
And so we're very excited, and in that evolution, I would say it's an evolution, not really a revolution, it's incremental. We are attracting new minds throughout the country who want to be part of this new model of delivering health care.
What is the message you're bringing to the attendees of this conference about what you're doing in Phoenix?
You know, we're talking, this afternoon we're talking about strategies and partnership and mergers, and how do you decide what the right strategy is when you find new partners. And I describe it as, what are you really solving for? I think a lot of mergers and acquisitions are very much horizontal. They just get larger and larger and larger, and perhaps they're solving for reducing costs or having more leverage in the payer market. Our challenge is, and I think the University of Arizona and Banner is doing that, we're actually solving for something very simple, which is, how do we improve care for our consumers? Who is our consumer? In this case, it's the individual patient, but also the individual student who wants to be a physician. It's the individual physician scientist who wants to improve how we deliver care, to improve the model of delivery. So we look at our different consumers and say, can we create a very different breed of partnerships where maybe the short term isn't going to be a financial gain for either institution, and it hasn't been, but the long term, we're actually going to add value to the citizens of Arizona, to the individual young man or woman who wants to be a physician, and more importantly is how do we deliver care that's just more value-based, we reduce waste, we can publish that, we can educate our future generation of physicians. And so the value equation that we're going to talk about this afternoon has to be focusing on, what are you solving for, and is the structure actually aligned to the solution? And I do believe that we have a new breed here between the University of Arizona and Banner, a partnership that's going to transform healthcare in Arizona.
All right, Dr. Narang, thank you so much for sharing your vision with us. Appreciate it.
Thank you for the great questions.
Thank you.
Have a good day.
And I'm Mabel Jong. Thank you so much for staying with us. Stay tuned.